Hello, welcome to our channel, Move Faster with Parkinson. Today we are going to discuss about exercises as a treatment for Parkinson's disease. This topic applies to everyone, not just people with Parkinson's disease. My name is Zayas. I am a physical therapist, a movement disorder neurologist located in Knoxville, Tennessee. Let me start with this. When I see a patient in the clinic with Parkinson's disease doing well, all of them, they have something in common. All of them are doing some type of regular exercises. I'm not talking about the exercises that you do when you wake up and you go to the bathroom and then to the kitchen. No, I'm talking about real, well-designed exercise program. The problem is that only approximately 20% of the US adults are doing sufficient exercise. And this is based on this article published in 2018 that they define sufficient exercise has at least 2.5 hours per week of moderate intensity aerobic exercises plus 2 days of resistant exercises. So basically people are not doing exercises. They don't do exercises, only 20% approximately. The good news is apparently it's improving during the last 4 years. So this is what are we going to learn today, okay? We are going to discuss about the why, the what, and the how. The why is the easy part. Is why we need to do exercises. Every healthcare provider will tell you to do exercises. Everyone agree that exercises is good for your health. The problem is when you get home and then you start thinking, what type of exercises? That's the problem. And we are going to discuss about what type of exercises. And then the how we stay consistent with exercises. That's the most difficult part. How we can be motivated to continue doing exercises and not losing what we gained during the temporary program of exercises. Because if you do that, if you do exercises for 1 month, for 2 months, and then stop, that's kind of like a waste of time. So it's very important that you make exercises a habit rather than a punishment. That's the key. And again, this applies to everyone if you want to live longer. Now, why? Let's talk about the why. Why this is so important. So these are the general benefits in older adults, and these apply to people with Parkinson's disease. Remember that the main risk factor for Parkinson's disease is age. So if you do regular exercises, the chances of you dying from a heart attack, from a stroke, decrease significantly. Okay. Also improve diabetes, improve bone health, assuming that you are doing weight-bearing exercises. Okay. Decrease the chances of you having some type of cancer, especially colon cancer and breast cancer. Prevent and treat obesity. And very interesting, this article published in 2016 circulation showing that having a what we call sitting disease, sedentary lifestyle, might be even worse than smoking, having high blood pressure or diabetes, which means that based on these type of studies, it is 2 or 3 times more likely for unfit people to die during a follow-up when compared with their more fit counterpart. Now let's talk about the benefits in Parkinson's disease symptomatic effect. So this is actually benefits. Some studies performed in patients with Parkinson's disease. Obviously, there are some limitations in the study, but this is what we have in 2021. So one of the symptoms that improve in Parkinson's disease is cognition, thinking, memory. Okay, remember that when I talk about cognition, I'm talking about multiple domains. One of them is language, one of them is memory, and many others. There are multiple studies showing that physical exercises programs such as tango, okay? Tango is a popular dance from Argentina. Cognitive training combined with motor training and treadmill training promote improvement of cognitive function in people with Parkinson's disease during mild to moderate stage, okay? There are one study also showing that if you do 60 minutes, 1 hour, 3 times a week in a treadmill, okay, you can actually improve significantly your cognition and your quality of life. There are many other studies showing the benefits of different types of exercises in PD. Let's talk about a few of them. Again, treadmill, walking, and stationary bike improve physical fitness in general, okay? LSBT, big. This is a very famous type of exercises in Parkinson's disease. We prescribe this a lot, at least in our clinic. Doing LSBT, big exercise program, improve significantly your motor function, your motor symptoms. And this is based on a scale that we use in the clinic. We call that a UPDRS. So when you see me writing numbers, 2, 3, 1, I'm calculating your score. And this is the way I monitor your progression through all these years, okay? So also, aerobic exercises improve sleep, okay? There are a few studies showing that. If you have depression, which is very common in the setting of Parkinson's disease, anxiety, which is also very common in Parkinson's disease, yoga and aerobic exercises is the way to go, okay? If you have significant balance issues, Tai Chi improve your mobility and your balance. We have data about Tai Chi improving those symptoms as well. We will talk about Tai Chi later a little bit more. Now, the big question that we have is if exercises actually modify Parkinson's disease. And what we know is that based on epidemiological study, people who are physically more active might be at lower risk to develop Parkinson's disease. We don't know if this is due to affecting the disease onset. We're not clear about that. We don't know if we are preventing or causing a delay in the development of Parkinson's disease itself by slowing down the underlying neurodegenerative disease, or we are inducing a compensatory effect in other areas of the brain that delay the manifestation of Parkinson's disease symptoms. We are not sure about that, okay? However, I really believe that exercises is doing something. And probably is causing us some type of compensatory effect in other areas, as I discussed before. But I'm not completely sure about that, okay? And nobody really knows. But something is doing. Now, let's talk about the benefits and the potential risk. So when you are going to start an exercise program, people are afraid of having a heart attack or having a fall. So, however, there are plenty of data showing that when you balance between risk and benefits, you see inclination to the benefits. So you can see here in this study showing that the benefit outweighs the risk. So the other question here is, how safe is exercises in the setting of Parkinson's disease? Well, we have data too, and it's pretty safe. If you are doing correctly and following the instructions of a professional in the area, such as a physical therapist or a personal trainer with experience in Parkinson's disease. There are actually no reported serious symptoms, exacerbation, or deterioration in any outcome measures. The risk is basically the same as the control group. When I say control group, I mean people without Parkinson's disease. Basically, the risk is the same. However, if you have chest pain, if you have shortness of breath, if you feel shortness of breath from walking 10 feet and you are passing out, you have significant metabolic issues, uncontrolled diabetes, renal failure, you might need to get a medical clearance prior to start doing exercises, because you might need some type of stress test prior to start doing a regular routine of exercises. Okay, this is very important. Now, let's talk about what type of exercises. Basically, the key here is anything that you like and enjoy. Otherwise, it's gonna be very difficult, okay? I cannot decide that. I can give you options, but it's your decision. For example, you are not going to see me doing yoga or water exercises, at least not for now, because this is not me, okay? Also, make sure that the exercises type match with your physical capabilities. For example, if you are having significant freezing of the gait, when I say gait, I mean walking, maybe treadmill is not a good idea for you. Maybe it's better to do a stationary bike, okay? So there are different options, and I got this picture from Amazon. So there are different prices. Sometimes it's better to go to the place and test by yourself before buying something. But there are many options. I like the ones with the lumbar support, especially because back pain, low back pain is a very common phenomenon. So I like to have some type of back support. So the other thing, for example, if you have significant amount of arthritis that limit the amount of impact, so maybe jogging or treadmill is not a good choice for you, and maybe for you will be better to do aquatic therapy, okay? And actually, this is a nice book about water exercises in the setting of Parkinson's disease. Again, you can get this from Amazon too. And for the people who live in the area of Knoxville, aquatic therapy is offered in a national fitness center, at least to my knowledge, last time I checked, okay? Make sure that if you are doing water exercises, somebody is checking you, okay? Very important. Now, boxing for Parkinson's disease. This is very good for socialization and very fun, increasing popularity. I will tell you, and I will have a different another slide later. If I have Parkinson's disease, I will be doing boxing. Okay, so improve balance, mobility, quality of life. So it's really pretty good. If you want to know where in your area are offering these type of exercises, Rocky Steady Boxing, you can go to the website, this website, and they will tell you basically where in the area. So dancing for Parkinson. So if you like music, rhythm, this is the way to go. You actually can be really motivated and with good socialization as well. Just be careful with falls. Dance can improve motor impairments, especially balance and motor symptoms severity in patients with mild to moderate Parkinson's disease. You can see that the majority of the trials of all these studies are performing patients with mild to moderate stages, okay? Now, Tai Chi is a type of exercise that combine slow movement with deep breathing exercises, reduce balance impairment and decrease falls, more than actually gentle resistant training or stretching when compared, okay? So very good type of exercises. I like it. I will tell you now my routine. When I say my routine, is what I would do with me if I start having symptoms suggesting Parkinson's disease, or what I would do with my father, knowing his limitation, if he start having Parkinson's disease. So I would prescribe the following. Number one, weight training program, okay? Before I go there, remember that the type of exercises depend on your stage and other medical condition that you have, okay? Also, if you have the type of exercises in the area where you live, you know, the prices, there are many factors. And also your personal preference. This is very important, okay? Now, and things change because remember that Parkinson's disease is a progressive disease. So the routine has to be modified, has to be changed, okay? So also remember that you need to warm up prior to do some type of weight training, okay? So this is what I would do if I have Parkinson's disease. I would do weight training, okay? I would do at least 2 days per week, and I will have 2 days apart. It's just to give some rest between exercise section. I would do probably Monday and Thursday. Equipment, I can use the TheraBands, the resistant bands, these bands here. This also, I got this from Amazon. So there are many places that you can buy this. Weight machine are good too, and free weights as well. So, but I think the using TheraBands, using resistant bands and weight machine probably would be better than free weights. You have a more control of the movement and probably less chances of you having a lesion, especially of the shoulder. But again, this depends on every patient. Now, the other part is aerobic exercises. So I would be doing at least 3 days per week, maybe a Tuesday, a Friday, and Sunday. What type of aerobic exercises? Well, again, in my case, I would probably would be doing regular biking, okay? And depend on the weather and all these factors. Jogging on a track or any flat surface, I would be doing that. How frequent? So, well, at least 30 minutes per section, okay? And progressively increase until I reach 2.5 hours per week. The other part is I would be combining some type of balance, coordination, stretching exercises with a multitask exercise with mind exercise. In other words, Tai Chi is the answer here, okay? So this is slow movement with breathing, combining these mind type of exercises is really good, okay? I will be doing 2 days per week, maybe Monday and Friday during the afternoon, half hour, 30 minutes per section, okay? That's my routine. This is what I will do if I have Parkinson's disease in the future. Now, this is the most important part of this video, okay? How we stay consistent. And this is what we feel, okay? Nobody can tell me that waking up at 5 a.m. to run 5 miles is fun, okay? But because it's not, unless you are with a group of people that you get along. So otherwise, you waking up at 5 a.m., 6 a.m. to do exercises is just very difficult. Our brain is not designed to be suffering, okay? Our brain will tell you to stay on bed and watch TV, okay? But you need to think about short-term and long-term benefit of exercises. Also think about the mental sensation that you feel when you finish a workout. It's just great, okay? So you need to visualize yourself as an athlete, okay? Have the correct mindset. Everyone have the capacity to improve mentally and physically, even patient in the ICU, okay? Works on your fears, okay, such as falling, worsening. So some people don't do exercises, and I'm talking about in the setting of Parkinson's disease, because they are afraid of falling down. They are afraid of symptoms getting worse, and low energy, okay? And actually, this is a study published, I think, last year, showing the reason why people don't do exercises in the setting of Parkinson's disease, okay? Again, make a habit. This is very important. You need to establish realistic goal, short-term and long-term, and never overcommit. Start maybe 3 days per week, but at the same day, the same time, have a structure, okay? This is how the things work. If you do one day at 8 a.m. and the next day at 11 a.m., this is not going to work. So you have to have a plan. The same time, the same day. Some people use apps. In your iPhone, you can get applications to monitor your performance and your progression. Always start small and increase progressively, but you need to progress, okay? Sometimes you need somebody to be with you with a better mindset to join you. That actually push you to do the exercises. Now, I have this question many times. Usually is the caregiver or spouse asking me, what can I do if he or she don't want to do exercises? Well, I divide this in 2 stages, okay, 2 parts. Number 1, you need to make sure that we rule out conditions, medical conditions that affect your desire to start doing exercises and to stay consistent with the exercise program. So you need to control these issues, otherwise it's not going to work, okay? So you need to make sure that we are treating your depression, your sleeping problem. If you have hypothyroidism, which is low levels of thyroid hormone, we need to treat that, okay? We need to check your medication side effect. There's even medication that we use in the setting of Parkinson's disease that make you feel more fatigued. So sometimes you need to adjust medication. Also, we need to treat chronic pain. Chronic pain is a problem very common in the setting of Parkinson's disease. And the thing is, sometimes patients with Parkinson's disease, they don't want to complain. And that's why we call this Parkinson's disease personality. They don't complain, but they are on pain. And remember that people with Parkinson's disease, they also have other common diseases. So what is common when you get older? Arthritis. So sometimes you have significant knee arthritis that doesn't allow you to walk well because you are having pain. So maybe what you need is a total knee replacement. If you get a total knee replacement to improve your function, then the ability for you to do exercises improves significantly, okay? So sometimes you have significant deformities of your joints and you might need to see a joint doctor. I'm talking about the rheumatologist. Maybe you have some type of joint inflammation process, okay? So we need to treat other conditions for you to start doing exercises and to have the desire to continue doing exercises. Otherwise, it's going to be very difficult, okay? The other thing is make sure that you are on. When I say on, prior to the exercise, I mean that you take your your Parkinson medication, your levodopa. When I say levodopa, I mean Ritari or Cinemet. Maybe 1 hour before. So you are on 1 hour or 45 minutes before, you take your pills and then you do exercises. So it's better you to feel on, okay? Because remember, fatigue and feeling tired could be actually an off phenomenon, okay? We discussed about fatigue in another videos, but you need to make sure that you are on. That might help you significantly. Now, stage 2. If you rule out all these medical issues, then you go to this stage. So maybe signing up in a group class might help. Paying for something is an indirect or direct way to push you to have some pressure for action, to do something, because you pay for that, okay? It's a way to compromise yourself. The other thing is, you might need to go with your spouse. So that creates actually a little bit of pressure. So go with him, go with her to the gym. That actually improve the probability of continue doing exercises. Again, have a schedule, okay? And actually in advance, at least one week in advance, write it down. Write the time. Okay, so I would do a Monday at 8 a.m. I would do this. Tuesday, I would do this. Have a routine. This is how the things works. Otherwise, it's not going to work. If you say, oh yeah, I'm going to do exercises next week, but you don't have a time, you don't have a plan, it's not going to happen. And these, again, these apply to everyone, not just people with Parkinson's disease. Go slow, okay? Don't push too much. Make things simple. Increase progressively the frequency and intensity, okay? You need to increase, but it has to be progressively. Every 2 weeks, every week, it depends. And remember, it depends on other comorbidities, other problems that you have around you, okay? Even 5 minutes to start is a good start, okay? Even 5 minutes. So don't think that I need to start with 1 hour. No, even 5 minutes is okay, but you need to progress. Now, what about if you still are not motivated? Well, then you need to find a good workout body. I have one. This is my dog that I use to help me, to keep me motivated. And even though that he doesn't like to, he actually likes to rest on the treadmill, but he helped me to be motivated. Summary. There is no reason to believe that exercise doesn't help to improve quality of life in PD. Exercises is medicine. And that's why we believe in rehabilitation, okay? We believe in rehab. Key is be consistent. Look for professional help. I'm talking about, obviously, your doctor, but also a physical therapist or a personal training with experience in Parkinson's disease. They are very well educated personal trainers around our area with significant amount of knowledge in Parkinson's disease that they can help you significantly, okay? And if you don't want to do it for yourself, do it for your family or the people who love you. This is extremely important for you. If you like my video, don't forget to like, share, and subscribe to my channel. See you soon.